Now moving ahead with the last and final triangle of anterior triangle of the neck, guys, that is digastric triangle. So we have already discussed about the submental triangle, the muscular triangle and the carotid triangle in detail. Now the last and final one which is remaining here is digastric triangle, and it is a very important one. First, to recall in your mind, this will be the anterior belly of digastric over here, and this will be the posterior belly of digastric over here, and this is the mandible. So basically this will be the digastric triangle, also known as the submandibular triangle. Now the most important thing that I wanted to tell you here is that in digastric triangle, basically we already know the boundaries of that, don't have to worry about that, but we need to learn about the contents of digastric triangle. And to learn the contents of digastric triangle, we don't exactly have to learn the contents, guys. The muscle that you are able to observe there or see there is actually the mylohyoid muscle. That is mylohyoid muscle. So that mylohyoid muscle, we are going to learn the relations of that, like what are the structures going superficial to that and what are the structures going deep to that mylohyoid muscle. And not only that, if you just remove that mylohyoid, you will be also able to appreciate one more muscle there, that is hyoglossus muscle. So please observe this diagram, the things will be much more clear what I am trying to tell you. So this one here will be the mylohyoid muscle. We are going to learn like what is superficial to that and deep to that. And this one from the hyoid bone going to the tongue, this one is hyoglossus. No doubt about that, that is hyoglossus muscle. And we are also going to learn the relations of that one, like what are the structures going superficial to hyoglossus and deep to hyoglossus. And once you learn the relations of these two muscles, mylohyoid and hyoglossus, once you learn the relations of these two muscles, that's all of those are nothing but the contents of your digastric triangle only, the triangle here, digastric triangle. So in the exam, what I have seen, like out of my experience, I am telling you, instead of asking you the contents of digastric triangle, mostly the questions will be like what is superficial and what is deep to hyoglossus, and what is superficial and deep to mylohyoid muscle. All of the following are superficial except one. These kind of questions will come. So the planning here, what I am trying to tell you, the planning here is that we are actually going to learn the superficial and deep relation of these two muscles, and once you are done with that, that itself is the content of digastric triangle. Let's make the things simple for you people, guys. Okay. Now please observe the diagram on the screen over here now. Now in this diagram, you are able to appreciate one salivary gland over there, guys, that is submandibular gland. Okay. And submandibular gland is actually having two parts here. One will be the superficial part. So this is the superficial part, which you can clearly see in the diagram. It's superficial to mylohyoid muscle. And then you are able to appreciate a deep part. There is a deep part of submandibular gland. And in this diagram, if you are able to see there, yes, you are also able to appreciate there will be a duct. And that duct from the submandibular gland will be Wharton's duct. Everyone knows that. Okay, so that is the superficial part of the submandibular gland, and that is the deep part of the submandibular gland. Basically, that's turning around that mylohyoid muscle. It's taking a turn there. Now, what I am trying to tell you here, what I am trying to teach you here, listen this point very carefully here, guys. You imagine like my one hand to be mylohyoid muscle. This is mylohyoid muscle. Mylohyoid muscle, suppose if here this is the superficial part and this is the deep part. Superficial part and this is the deep part. Now, we have to learn what are the structures passing superficial to mylohyoid, and then we have to see what is passing deep to that one. Okay, fine, well and good, no problem till here. Now, inside this mylohyoid muscle, imagine my hand to be mylohyoid. Inside this mylohyoid muscle, you are able to appreciate there is hyoglossus muscle from the hyoid bone to the tongue, hyoglossus muscle. Now, the good thing here is that hyoglossus muscle, this is the superficial and this is the deep part of that one. Now, whatever is present superficial to hyoglossus, that will be obviously deep to mylohyoid. Understanding my point here? So, whatever is present superficial to hyoglossus, that is nothing but deep to mylohyoid. So, we don't have to learn it like again and again. So, basically what we will do, first of all, let us learn about hyoglossus muscle, like the superficial and the deep relations of that. And once you are done with these two, then mylohyoid will automatically become easier, guys. So, let us concentrate first on what are the superficial and deep relation of hyoglossus muscle here. So, further what I am going to do here, let me remove this muscle from here. Mylohyoid muscle, let me just remove that part. If I remove that mylohyoid from here, then directly I will be able to appreciate hyoglossus muscle. Perfect. Now, in this hyoglossus muscle, again the same thing, guys, as usual, our habit. First, I will teach you in this atlas diagram here, and then we will draw our diagram, guys. Okay. So, look at this diagram here. In this diagram, I hope you are able to see this nerve, and this nerve will be the lingual nerve. lingual nerve here, guys. And just look at that lingual nerve, follow that one, guys. And that is the lingual nerve which is going superficial to hyoglossus muscle. So let me first of all teach you what are the superficial relations, guys. Lingual nerve number 1. And already in the cranial nerves topic we have discussed, lingual nerve is the one which is going to pass through this ganglion, and this ganglion will be submandibular ganglion. In fact, it is the topographical nerve to that submandibular ganglion, that is submandibular ganglion. Then there is a muscle here, there is a process, this process will be the styloid process here, and from the styloid process this muscle which is going to your tongue, that will be the styloglossus muscle. Styloglossus muscle. And then look at this nerve here, this nerve will be actually your 12th nerve, guys. That is hypoglossal nerve, and hypoglossal nerve again the same thing, it is going to take a turn and then go and supply to all the muscles of tongue. Apart from all these structures, one more structure which is present superficial, that is missing in this diagram here, will be the deep part of submandibular gland over here. There will be the deep part of submandibular gland along with the duct which is winding around this lingual nerve will be the Wharton's duct. Just to make you like more clearer, let us go back to the same diagram again. Yes. So this is the superficial part and this is the deep part here, and deep part along with the Wharton's duct is present superficial to hyoglossus. Hope I am not confusing you. So let us do one thing here, guys. Let's draw this diagram like all the superficial relations of hyoglossus in this diagram here. Superficial relations of hyoglossus muscle. Now what will be the superficial relations of hyoglossus muscle? To understand that, let's draw a diagram here. And then below here, for example, if you have the hyoid bone here, okay, and then there is a muscle between the hyoid bone here and then the tongue here, guys. You just imagine that one as the hyoglossus muscle. So let me just write down the name here, guys. This is nothing but your hyoglossus muscle over here. Now what are the structures which are actually related to this one here? First of all, yes, styloid process, and from there will be a muscle going to the tongue, and some of the fibers will also merge with this one also, guys, and this one will be the styloglossus muscle. Styloglossus muscle. Then there is a nerve, that nerve will be actually the lingual nerve, that is the lingual nerve, guys. And lingual nerve is the one which is passing through a ganglion here, and that ganglion here will be the submandibular ganglion, that is also present superficial to this muscle. So let me just write it here only, along with submandibular ganglion. Lingual nerve along with the submandibular ganglion. These two are done. Then you will also be able to appreciate one gland here. Which gland? Submandibular gland. But which part of the submandibular gland will be present here? That is the deep part, and along with that there will be a duct, and that duct will be the Wharton's duct. Submandibular salivary gland, and that is along with the duct, and that duct will be the Wharton's duct, the duct of the submandibular gland. And finally you will also be able to appreciate one more nerve, and that is the nerve which will be going and supplying to all the muscles of tongue, and that nerve will be the 12th nerve, the hypoglossal nerve, that is your 12th nerve. So all these structures which we have written here are going to pass superficial to hyoglossus muscle. Now once you are done with these superficial structures, again we'll do one thing here, guys. Let us just actually go back to this diagram here, and in this atlas diagram here, let us again appreciate what are the structures going deep hyoglossus muscle here. Now in the same diagram here, let us see what are the structures going deep, guys. In this, I would like you people to focus on this ligament here. That ligament again from the styloid process going to the hyoid bone, stylohyoid ligament, and that stylohyoid ligament you can appreciate here, it's actually going behind the hyoglossus muscle. Then look at this yellow colored nerve here, guys, that is your 9th cranial nerve, glossopharyngeal nerve. Even that nerve is also going behind the hyoglossus muscle. And then here this artery will be actually the lingual artery, of course going to the tongue there, and that even the lingual artery is also going behind the hyoglossus muscle, guys. So stylohyoid ligament, this time it is not the muscle there, guys, it is actually the ligament. Stylohyoid ligament, the 9th nerve, and the lingual artery all these three structures are going deep to hyoglossus muscle. Now let's draw our diagram here. Structures deep to hyoglossus. The structures which are going deep to hyoglossus muscle, guys. Now let's try to draw the diagram here. So this one will be your tongue over here, guys, again, and imagine this one to be your hyoid bone here, having that greater horn and lesser horn and all, and then imagine this one is your hyoglossus muscle here. Hyoglossus muscle. Now this time we are going to see what are the structures which are going deep to hyoglossus. There will be first of all a ligament here, guys, and that ligament is again coming from a process here known as the styloid process, and that ligament is actually going behind, and it will go and get attached to the lesser horn of the hyoid bone only. Stylohyoid ligament. Stylohyoid ligament. Then there will be a nerve here, the nerve which is going to pass behind the hyoglossus muscle over here, guys. That is your 9th cranial nerve, glossopharyngeal nerve here. And finally here there will be one artery, and that artery is going to also go behind the hyoglossus, and this artery is said to be the lingual artery. Lingual artery. And these are the structures which are actually going to pass deep to hyoglossus. So that is the main questions, or these are the main MCQs that will be asked in your exams, guys. The structures deep to hyoglossus and the structures which are going to pass superficial to hyoglossus. And as I told you right now, let me take you again back to the same diagram which I showed you in the very beginning here, guys, this one. So just now we have seen what are all the structures passing deep and superficial to hyoglossus. And the good news here, the good thing here is that whatever structures are present like superficial to hyoglossus are present deep to mylohyoid. So you don't have to learn about them. I repeat again, whatever structures are present superficial to hyoglossus muscle are present deep to mylohyoid only, guys. Deep to mylohyoid. You don't have to learn about the deep relations. So therefore, what are the deep relations of mylohyoid right now? Nothing but superficial relations of hyoglossus. Lingual nerve along with the submandibular ganglion, submandibular salivary gland along with the Wharton's duct, styloglossus muscle as well as the 12th nerve, that is hypoglossal nerve. So you don't have to learn the deep relations of this one. Now the only thing that is left out is to learn the superficial relations of mylohyoid. Now let us see what is present superficial to mylohyoid, sir. Superficial to mylohyoid. Now one thing that you already know, number one, that is submandibular gland, that is superficial part. So superficial part of submandibular gland, superficial part of submandibular gland, that is present superficial to mylohyoid muscle. Number two, what else do you have here? So what else is passing superficial to mylohyoid muscle? There will be anterior belly of digastric, anterior belly of digastric muscle. And not only that, the last and final one, the important one, of course you have got the vessels and nerves over here, nerves and vessels, and the name of that is very simple. It is known as the mylohyoid nerve and the mylohyoid vessels only, sir. So mylohyoid nerve as well as the vessels. So these are the structures present superficial to mylohyoid. So basically they are like two muscles, and two muscles we are learning deep and superficial relation. And why? What is the reason? Why? Because all these structures which are present superficial and deep to hyoglossus and mylohyoid are nothing but the contents of digastric triangle. So that makes the digastric triangle easier, and simultaneously we have completed in a very conceptual manner, guys. That's all about this one, and by this we have completed all the triangles of neck. The anterior triangle divided into 4 triangles, guys: submental, the muscular, digastric triangle and the carotid triangle. All the triangles, the boundaries and contents has been done in a very conceptual manner. That's all.